Welcome to the Learning Center, a place where nurses can learn and discuss the newest and best practices to triage their patients. I am Marcy Line, the Triage Logic Nurse Educator.
Here's a quick question. Would you consider it to be acceptable to fold laundry while taking triage calls? I mean, nobody's going to hear it, right? Nobody's going to know. So is it okay? Why or why not? Whether you are working from home, an office, or a hospital, it's important that you have a work environment that is comfortable and conducive to working with callers. Make sure there are no distractions such as television, children, or pets in the room, and do not eat or chew gum while answering calls. We're going to discuss how important it is to remain focused on the caller so that you can gather the correct information and provide a professional and courteous call. Before you start your shift, allow 15 minutes to prepare and ensure your equipment is working properly. This may include checking your phone, computer, and internet, and making sure you have a notepad and pen handy. You may also want to inform your backup nurse that you are ready to start your shift. Once your shift ends, complete the steps required by your employer, such as sending a report of the activities, including number of calls answered, unusual calls or situations, and any difficulties you may have encountered. As a telephone triage nurse, it's important that you create a good experience for your callers, even though that may be challenging due to the distancing factor telephones create. Think about some of the experiences you've had when on the phone call with a service company. There are things you can do to exemplify these traits from the moment you answer the phone and throughout the conversation. Let's look at some of the things you can do to create a positive call experience and see how these characteristics tie in. Which person would you rather talk to? The smiling one? Or the one who sounds tired, cranky, and like she doesn't care what you need? There is an art to answering the phone, and you will be more helpful to your patients and enjoy your job more if you practice the techniques we are going to cover. From the very moment you answer the phone, you have the ability to create a positive call experience. So when you answer, smile and have a friendly voice. Your goal is to build the caller's trust in you, to show empathy. You need to remain friendly but professional and be encouraging, but get the questions answered as needed to assist the caller. The caller is going to be scared and worried, so you need to be calm and confident. To be calm and confident, you want to avoid weak phrases such as, I think, or maybe, or I'm not sure. Believe in yourself, your knowledge, and your abilities. When you don't know the answer, say, let me check into that for you, and then do it, and get back to them. Utilize your company's resources and get their assistance as needed. Effective listening includes 3 skills: active listening, reflective listening, and empathic listening. Active listening is using short, encouraging words or phrases to let the caller know you're listening to them, such as, yes, I see, or I understand. Reflective listening includes paraphrasing what the caller said, asking clarifying questions, and encouraging the patient to talk by asking open-ended questions that require more than one-word answers. Examples include, can you describe what happened? Do not provide opinions. Stick to the facts. That's very important. Empathic listening is demonstrating attention to what the caller feels, not just what's happening. Examples include, you must have felt, or what I'm hearing is you're concerned about. Practice all of these techniques, and you will become a better call representative.
Now, let's go into more detail about active, reflective, and empathic listening.
Active listening is something my mother was never very good at. I would talk to her about my latest project, and after a few sentences, she would start her automatic, uh-huh, mm-hmm, uh-huh. It drove me crazy. Now that is not a good thing to do when on the phone with a patient. Generally, active listening refers to nonverbal demonstrations that you're paying attention. But since your callers can't see you, we have to loosen up that definition a bit. Without using uh-huh or how might you interject without completely interrupting a caller? How about occasionally saying things such as, okay, I see, yes, I understand. Those phrases are encouraging without taking over. The key here is listening. Don't start thinking about your response. There will be many times when reflective listening can help you through a conversation. Again, you want to actively listen and be fully present in the conversation. Paraphrase what the caller says. Ask clarifying questions to ensure you're on the same page. And encourage the caller to talk through the use of open-ended questions. Open-ended questions are those that cannot be answered with just a yes or no or other one-word answer. Some examples. Can you describe what happened? Or, in paraphrasing, you say you're concerned about the wound on your foot. Is that right? A clarifying question. So it sounds to me as if, or you could say, do I understand you to say that? Don't say, I think you should, and then give them an opinion. Be definitive about what they need to do. Remember, confident, but not arrogant. The definition of empathic listening is the skill that demonstrates attention to the emotional aspect of the patient's story, not just the facts of the matter. Empathic listening puts additional focus on how the patient feels, not just what is happening. As you can see, there are many phrases that you can use to demonstrate active, reflective, and/or empathic listening. Pick your top 3 and practice those so they become a part of your telephone personality. Actually, using active listening can be very advantageous in every professional and personal conversation. So the next time you're involved in a difficult conversation, pull out your active listening phrases and see how they help. Coming up next, we're going to discuss managing difficult calls. But first, let's test what you know about reflective listening. Now let's review Section 1, Working with Patients. Before the start of your shift, you should set up a positive work environment. Get rid of any distractions and make sure you have the tools you will need and that your equipment is working properly. A good call representative can create a positive experience for the caller and him or herself. Traits of a good call representative include patience, caring, helpful, courteous, confident, and resourceful. When answering the phone, smile. Be friendly yet professional, and remain calm and confident so that the caller feels they can trust you. You can display your calm confidence by believing in yourself and your abilities, and knowing your limitations, and not being afraid to ask for assistance from your supervisor or physician.